If your neck feels stiff, tight, or painful, you might not just be dealing with the discomfort, you could be setting yourself up for headaches and even nerve issues. But the right stretches can change that. Your neck isn't just holding up your head, it's actually the control center for movement, posture, and even how well your nervous system communicates with the rest of your body. When it's locked up, everything suffers. You get tension, headaches, and even maybe tingling down the arms. So right now, I'm going to show you the 3 best stretches to relieve neck pain and stop headaches before they even start. Here's stretch number 1, the upper trap stretch. Now, it's very simple and it's going to target this upper trapezius muscle, but I just put upper trap for simplicity's sake. But it's like on the top of your shoulder and upper back, right up here on both sides. So you're going to do this on both sides of your neck. But what you see here in the picture is so let's just start on the left side of your neck. So you're going to put your left arm behind your back or underneath your thigh or holding on to the chair because we want to make sure we keep that shoulder down. Now from there, you simply just bring your right hand up on the top and side of your head and gently pull your ear towards your right shoulder. And you want to feel a stretch in your neck, upper back, and even, it might even reach getting into the shoulder, like right up here, not the, ball and socket of it, but right up there. And you want to hold that stretch for about 25 to 30 seconds. That's a good time frame to help relax that muscle. You can do this one and the other ones I'm going to show you. I want to make sure I mention it. You can do these like 3, 4, 5 times a day. There's not really a limit on how much you can do this. I mean, for every hour that you spend at the computer or hunched over, this is a good stretch to incorporate, and it just helps to relax the muscle. Now, what you can also do to make it even more mobility based, which means, more flexibility and strength at the same time, working the muscle a little bit more than just the stretch, which this helps with flexibility and relaxation, is without even putting your hand on the top of your head. So you can have your arm behind here just like this, and without bringing your hand up, you take your ear towards your shoulder. If you want to look at me in the window here, you take your ear towards your shoulder while keeping the other side down. So you hold for just a second or two and you go back and forth. And that gets even more of the joint movement involved, getting into the joint level of the spine. And you can do it one side at a time, or you can go back and forth if you're doing more of a mobility. If you hear a few pops or the bones popping, that's fine. You're not forcing it. So it's fine. It's just pressure releasing. So that's the upper trap stretch. You can, again, combine this one. So this targets more the side of the neck and the side, like upper portion of the upper back towards the shoulder. But this next one I'm going to show you targets more of the back of the neck, and then like the back and the side of the neck into the shoulder blade, which is a very common area where people get these tight, tender knots in the muscles called trigger points. So this is called the Levator scap stretch. And you see I'm smiling here because it's fun to stretch. It's fun to take care of our spines, right? So it's a very similar process. We want to keep the arm down. So again, you can put it underneath the chair, underneath your leg. You can put it behind your back like you saw in the previous picture, but it's to keep the shoulder down. So this here, I'm going to be stretching my left levator scap. So the left arm is down. You're going to look to your right and you're going to look down towards your armpit. Basically, how you want to envision it is taking your nose towards your armpit of the opposite shoulder or opposite arm. So you see left arm down, I'm stretching the back side left part of my neck. And this is how you do it too. And it goes down into the upper back. If you can see me on the screen there, but it's right up here. like the top of the shoulder blade. And I bet if you reached back there, you could probably find some tender spots. It might not bother you all the time, but when you push on it, that again, that sign of theirs, a trigger point, quote unquote, damage to it. It's overworked. That's a good word for it. So from here, just like very similar to the last stretch, the upper trap stretch, you're going to bring your hand more on the top and back of your head rather than the top and side of your head, top and back. And you're just, again, gently, we want to gently do this, increasing the stretch till you feel the stretch in the upper part, okay, in your neck, and then also the upper part of your upper back, where you're taking it down, making sure that arm stays down on the opposite side, holding for 25 to 30 seconds. So again, matching this one with the previous one, with the next one I'm going to show you, it's a great mix. I mean, when I had neck pain and when I first started seeing a chiropractor, these are the stretches that he showed me. Again, I had headaches too, migraines, and these have helped me immensely. I show my patients these, especially when they have neck pain and tightness and stiffness in their neck. So hold 25 to 30 seconds. Again, 3 to 6, to give you a number, 3 to 6 times a day, holding for 25 to 30 seconds, or very similar to the mobility I showed you with the upper trap going side to side. You can do this one too, keeping your arms down, looking towards your armpit. You can do one side all at one time and then go to the other side, or you can alternate going side to side. Again, just gets more of the joint involvement, makes you control it even more, and probably even increases the blood flow, whereas the stretch helps to engage more relaxation. And you want to make sure you're breathing while you're doing these stretches as well. So that's the Levator scap stretch. And now let's get the front side of the neck. So here's the third one. Long muscle name here, sternocleidomastoid. It's again just where these the muscle is attached, the areas of the muscles is attached. But for ease sake, let's just call it the SCM, because that's typically what we do. So this is for the front side of the neck. So in the picture here, you see, again, I'm going to be stretching my left SCM muscle. So you're going to put your hands on your collarbone and just kind of pulling on the skin or tractioning the skin down just a little bit. You're taking your hands down slightly on the shoulder blade, pulling down. And as you do this, you're going to look to your left. So you're looking to the same side as what you're stretching. Look, and then you're going to tip your head away, taking your ear towards the opposite shoulder. So looking to the left, tipping your head back. It's like you're thinking, like you're, looking up there, and you want to feel a nice stretch right in the upper or in the front side of the neck. What you can even do is, so rotate, tip to the opposite side. And what you can even do is tucking your chin. It's just a subtle movement, tucking your chin back. Again, while you're still holding it here. Holding 25 to 30 seconds, doing on each side, 3 to 6 times a day to help to relax that muscle. This one gets tight, especially if you are in a forward head position, a slump position, which unfortunately many of us are in with the technology, with the sedentary lifestyles that we are having, and that leads to neck pain, headaches especially. This is a great one if you have headaches already. The other two are as well, but I found this one is really helpful for that. And you might even feel it pulling up behind the skull. Okay, it's called the mastoid process. That's where it attaches. That's why it's called sternocleidomastoid, because this muscle is attached to the sternum, the clavicle, and the mastoid. So here, back, hold 25 to 30 seconds. Now, this one I found works best as a stretch rather than as a mobility exercise, because it definitely targets more of the muscle rather than getting into the joints. And here's the deal. If you want to see how to, went back, wrong direction here. I have this spinal hygiene mini class, and it lays out for you like 4 simple solutions to hydrate, move and support your spine, maintain healthy postures for a pain-free active life. So I go over 4 different things, hydration wise, exercise, adjusting your lifestyle, and then even the missing piece to a lot of people's spinal healthcare program is traction, how to use towels to make sure that you are supporting the natural curves of your spine and taking stress off your spinal cord. So if you want that, definitely type in spine in the comments and I'll make sure that you get that. I'm also going to supply some links for some exercises, other exercises to help take stress and tension off of your neck. One, more of an active exercise. It's kind of redundant, but it's an active strengthening exercise for the muscles of the neck. And then also one, to help correct this thoracic kyphosis or to help this slumped hunchback posture, which also predisposes you to neck pain. So check that out. Be your own guarantee for your health in your life. Make sure you like, subscribe, hit the notification bell. So make sure you get notifications when my next video is out. All right. Talk to you soon.